Welcome to another edition of our Dan Education series. We're taking on a serious topic today, the topic of diving fatalities. It's important for divers to know about this in order to prevent them in themselves, but also to know what to do if they witness or are actually part of the resuscitation team in the case of a diving fatality. Keep watching. Much of what will be discussed in this episode of the Dan Education series is the outcome of a workshop in the medical examination of diving fatalities. The symposium was really geared towards medical examiners, but many issues were discussed in the workshop that are pertinent to diving professionals and, of course, divers at large. One of the first issues that came up is that a diver dying does not necessarily mean drowning. Now, if you think about it, you have a person who is breathing air going into water, returning to the surface unbreathing or non-breathing, then it would be very easy to come to the conclusion that they drowned. But there's so much else that goes on, because there may be things like entanglement and entrapment, getting a fright from a cuttlefish, or having a perforated tympanic membrane resulting in a panic ascent causing arterial gas embolization that may mimic a heart attack. So these and many other cases in the past have been labeled as immersion or drowning related deaths, and most coroners or medical examiners would make that diagnosis. But there are other causes for inhalation of water, which happens in the case of certain events related to drowning or asphyxiation in water, or there may be so-called dry drownings. The real question is, what is behind it? What led to the ultimate event that resulted in the drowning? Now, cardiac conditions are very common causes. And here we have atherosclerosis and left ventricular hypertrophy, or enlargement of the left ventricle. Atherosclerosis occurs when the coronary arteries are narrowed as a result of cholesterol and plaques that may break off or cause a thrombosis or blood clot and interrupt the circulation to the heart muscle and cause an arrhythmia. Hypertrophy may be the result of long-standing hypertension or high blood pressure. Both of these may be a huge risk factor in causing a heart attack that kills instantly or sometimes some days after diving. It is the arrhythmia or the rhythm disturbance, the disruption of the even flow and pumping of blood through the body, that is usually the cause of death. The dilemma is that once a diver has died, these things are not that easy to see. An arrhythmia or irregularity of heartbeat cannot simply be observed during an autopsy, because there isn't an EKG that's running or any other device that will show that. It's important to look for other signs of why the heart may look abnormal, or that there may be a blood clot, or that there may even be bubbles in the blood vessels of the heart. So how do we look for preventable causes of death? Well, the quality of investigation is really the result of the quality of information that is provided to the coroner or the investigating pathologist, as well as the skill and dedication and their observations made during the autopsy. It is, after all, an unnatural death, and therefore in need of a formal examination. But that does not necessarily mean that the quality of the examination will go any further than drowning. That's not useful. What we want to know is why. What's the root cause? What is behind the reason of the person ultimately dying underwater? One of the very important things that we want to emphasize for anybody involved in a case of a serious diving injury or a diving fatality is what to do in the field. Why? Because a big aspect of investigating a diving fatality is preserving the evidence. And this requires both impounding the equipment as well as making sure what the gas quantity and the position of, for instance, the tank valves are. The recommendation is for a written document to be started immediately or as soon as possible, the position of the gas or tank valves to be made, and for all gas cylinders to then be turned off. In other words, the valves to be closed so that there is no further leakage of gas, and if a gas analysis is required, that these can be made. Now, there are different conditions in which a diver's death may occur. Sometimes it happens and there is no specific rescue attempt. There may not be witnesses that actually see what happened. There may or may not be a resuscitation attempt, in other words, cardiopulmonary resuscitation. And there may or there may not be equipment available to assist in the investigation. Again, as we said, make sure that the equipment that the diver was wearing accompanies the body for the coroner's examination. It should not be returned to the family or to the dive store. It should be impounded and forms part of the investigation when a diver dies, and is part of the autopsy procedure. Now, the history of a diver's health or lack of health is something that should be known and should be written down. If it was known that a diver had a history of high blood pressure or was taking blood pressure medication or other medication, this should be noted. The resuscitation attempts, the transportation means, for instance, on the back of a bakkie or in an ambulance or in an aircraft, getting the diver at that stage, possibly still alive, to the place where they are declared dead. Then there's the scenario of the witnesses, what was seen, statements taken from the individuals who participated or witnessed the event. There's the information related to the recovery of the body or equipment that should be described and documented and preserved. The transportation to the facility may also sometimes not only take hours, but even days. And then there's the issue of possible decomposition that occurs, particularly if it is in a hot climate and there is no refrigeration capability. These should all be considered and documented as part of the preparation for autopsy. The autopsy findings may not necessarily be able to account for all the interventions that were made, and therefore it is critical for all of these bits of information to be captured and to be written down meticulously and to be given to the chief investigating officer or the member of the police force, or in the case of an evacuation to a medical facility, the chief of the medical team, chief paramedic of the medical team. So now let's look at the post-mortem aspect. In other words, the investigation after a diving fatality. Ironically, very few forensic pathologists ever see a diving fatality, because they're not that common. In the United States and Canada, there are about 100 per year, and there are far more pathologists. Far fewer occur in countries such as South Africa, so the exposure to these fatalities is rare, and therefore the skill and the specific specialized information may not be available and not necessarily be readily known. It's important to know the recent health history of the diver and any medication, anything else that may describe or explain why the diver was suddenly in distress and not just simply breathing their compressed gas. It's important that all these documents are made available for the examination. Remember, sometimes these fatalities occur in first world countries, and sometimes they may occur on islands in the tropics where this information is not necessarily readily available or made readily available. So someone should make a point of doing that. And such a person, a recorder, should be appointed very, very early on. The more information the pathologist has, the better they are able to come to conclusions as to what contributed to the diver's death. One of the things that came up that may not be readily available to coroners is what happens with rebreathers. Because with rebreathers, there may be 3 root causes of a fatality. Hypoxia, which is the typical cause of loss of consciousness and death underwater, may not be the only potential cause with a rebreather. Hyperoxia, in other words, excess oxygen, or hypercapnia, excess carbon dioxide due to a failed scrubber, may also be common causes of rebreather failures and should be made available. This information should be made available to the forensic pathologist. The mechanisms involved may also not necessarily be common knowledge to the forensic pathologist. For instance, the electronics, the oxygen cells, and the various other controlling systems of the rebreather may play a role and may not be available. And therefore, it is invaluable to have an expert on diving equipment that is relevant to the diving investigation to be available, if not physically, then at least by phone during the examination. Now, in terms of the expert panel review on the investigation of autopsy findings, the following common trends were seen, and these we would like to present as ways of encouraging divers to make sure that this does not apply to them. And the first is to ensure that there is physical fitness to dive. Train for your sport. Be sure that you exercise regularly and follow a healthy diet. Use the buddy system. Follow your training. Check your gauges often. Respect depth and time restrictions, and do not dive beyond your training limits. Weight yourself properly, and remember to release your weights if necessary to maintain flotation. Ensure that your skill level and familiarity with the conditions that you're diving in are appropriate. Have your equipment serviced and maintained regularly. Account for all divers, meaning that when a diver boards or reboards the dive vessel, you get a physical response from them, and that one can assess the diver's medical status when entering, but especially when exiting the water. Avoid overhead environments unless properly trained and equipped. Breath-held divers should remember that the buddy system is important and be aware of the dangers of shallow water blackout. Next, we'd like to get to just some of the basic aspects of the autopsy protocol that may be relevant to the divers rather than the pathologists. We won't get into that, and we refer divers to the proceedings of the workshop in order to get additional information. History. Absolutely essential to capture the important aspects of the history of the recreational diving fatality. Get the information on past medical history, particularly as it refers to cardiovascular disease, seizures, diabetes, asthma, or any other chronic pulmonary disease. Medication taken on a regular basis, as well as on the day of the dive, should be recorded, and this should be reported as part of the investigation. A history of drug or alcohol use should be noted. The dive history is important, and in fact the pattern of the diver's diving habits may be relevant, because that forms part of the diving history. The dive profile is another essential piece of information and may sometimes be available electronically. If by any means possible, a download of the dive profile should be made available, as this may provide invaluable information to the investigation. Not only will the very last dive be made available, but the whole dive series would then be available for scrutiny and for assessment. It will show dive habits and breathing patterns. Written logs, if these are available, should also be made available. So the questions then that divers should answer or try to answer and contribute in the form of documentation include when the problem began. Was it pre-dive, during descent, at the bottom, during ascent, or post-dive? Did the diver ascend rapidly, which would be a factor in air embolism or pulmonary barotrauma? Was there a history of entrapment, entanglement, or trauma? Was there a resuscitation attempt? And what was done, and how did the diver respond? All of these questions may make a simple examination far more useful in determining the trigger and the ultimate cause of death, and make a diving fatality serve as a warning and hopefully a preventative aspect of further diving fatalities. We hope that this DAN education piece was of value to you, and although the topic was a rather morbid one, it is an essential one nonetheless. Thank you for watching. We encourage you to follow us on social media and Twitter, and of course subscribe to this channel.